Hello everyone, this is Kim Jongseo. I'm very glad to see you here today. I like the movie called When Harry Met Sally. In the movie, Harry met Sally and they lived happily ever after. Same as Restylane met Dysport. The two products met and we can treat our patients with both products, making our patients happier. I thought about the meanings behind the names Restylane and Dysport. Restylane is good for treating resting wrinkles that appear when a person does not make any expressions. Dysport is good for treating dynamic wrinkles that appear with expressions. I think maybe the company named the products thinking about this. If you look at it more closely, the latter part of Restylane is lane, which means a narrow road. In my opinion, this represents narrow and long wrinkles. In conclusion, the name Restylane means resting wrinkles. Do you all agree? The front part of Dysport is dys. Again, I think dys means dysfunction. Let's think about how a computer monitor works. Signals from a computer are transmitted through a port to a monitor, turning the monitor on. The port acts like a neuromuscular junction. Dysport is toxin to induce dysfunction of port, neuromuscular junction. Dysport can be used in numerous ways, treating signs of aging, changing face shapes, and etc. Its main usage, where it's most effective, is treating wrinkles. As I mentioned, Restylane is used to treat resting wrinkles, and Dysport can treat dynamic wrinkles. Then what about droopiness of face? We can also treat the droopiness with intradermal injection of Dysport. On the right picture, you can see dynamic wrinkles around glabella and mouth area. These angry or sad-looking expressions can be treated with Dysport. These are other signs of aging we can treat with Dysport and Restylane. We can also improve body shape by using Dysport as well. We can do this by inducing dysfunction of communication between muscles. This is Dysport. Do you know this? Dysport is the king of all toxins. It's the most potent toxin of all. Dysport contains toxins produced by C. botulinum bacteria. This bacteria is very strong against heat and is present in soil. This is the toxin made by C. botulinum. Its weight is about 150 kilodalton. Years ago, Europeans experienced paralysis after eating rotten sausage. They believed that rotten sausage caused paralysis and named the bacteria sausage in Latin. Botulus means sausage in Latin. This food poisoning by rotten sausage caused headaches, constipation, and paralysis. Normally, food poisonings by other sources cause diarrhea, not constipation. Babies are vulnerable to the poisoning by botulism. If your baby can't eat and looks lethargic, you should consider botulism. Botulism can also spread through wounds. In this case, symptoms appear later and last longer. Botulism is common around us, and many botulus bacteria lives in soils. And we can contract it if we eat expired canned food. The symptoms appear about 1 day after you eat the food. Last year in Korea, cows died with an unknown reason. It was found later that the cause was botulism. If we knew this earlier, we could have saved the cows. The cause of death by botulism is respiratory failure. If we helped with respiration, the cows could have been saved. Botulism is an acute afebrile symmetric descending flaccid paralysis that always begins with bulbar musculature. It always has cranial nerve palsies. The rapidity of onset and the severity of paralysis depend on the amount of toxin absorbed in circulation. Recovery results from new motor axon twigs that sprout to reinnervate paralyzed muscle fibers. This is what we call bypass. This is a typical face infected with botulism. He looks a bit stupid, but his mind is completely normal. In the blood test, 1 milliliter of his blood contained 1 unit of toxin, botulinum. These are the symptoms of botulism. Do you know the difference between symptoms and signs? That's right. Symptoms are what patients feel and experience. These are the signs of botulism. We can see the descending of paralysis. It starts at bulbar cranial nerve and slowly works itself down. There are 7 serotypes of botulinum toxins. For immunization, we need different antibody. This is serotype. Let's look at the composition of the toxin. It is composed with light chain and heavy chain. Each chain serves different purpose. Heavy chain acts as a key to get into presynaptic nerve membrane. It has a key-shaped It has a key-like shape that connects to the membrane and penetrates inside. This keyhole of door on the nerve membrane is called SV2 receptor. On the other hand, light chain actually causes paralysis. It breaks SNAP. I'll explain this more in detail later. Motor nerve is connected to muscles via port. Computer and monitor are connected via port. This is port of human. This is photo of electron microscope of neuromuscular junction. The toxin works in a 4-step process. In the first step, binding, heavy chain opens the door to nerve membrane SV2 receptor with heavy chain's key-shaped head. In the second step, internalization, the toxin enters into the membrane. And in the third step, light chain is separated from the heavy chain and is released into neuromuscular junction. In the final step, the separated light chain breaks SNAP25. Normally, SNAP25 helps neurotransmitter to connect to a presynaptic membrane. So when it is broken, neurotransmitter cannot connect and go outside of the membrane. As a result, even when brain signals, muscles will not respond. After a few months, neuromuscular junction recovers from the bypass and will respond normally. This picture shows how normal neurotransmitter release works. As I mentioned before, there are 7 serotypes of botulinum. Type A breaks SNAP, and type B breaks synaptobrevin. Let me tell you a side story. A bacteria called C. tetanus is in the family of C. botulinum. C. tetanus, however, causes muscle spasm, not paralysis. A bacteria in the same family as C. botulinum is causing opposite reactions. Tetanus blocks and inhibits neurotransmitter GABA and glycine. This is C. tetanus. Tetanus is very similar with botulinum. The toxin of tetanus is composed of 100 kilodalton of heavy chain and 50 kilodalton of light chain, the same as C. botulinum. And heavy chain is required to enter, and light chain causes the disease itself. So many things are the same. This patient is showing signs of tetanus. Although it's not the best choice, benzodiazepine is used to sedate neuromuscular junction and treat tetanus. I thought we might be able to treat tetanus with Botox. What do you think? Baby in the top is suffering from botulinum, hypotonia, and baby in below is suffering from tetanus spasm. As you all know, in research papers, scientific names are used instead of brand names. Dysport is written as ABO something or as ONA something. I want to see the toxin with SEM. These are the SEM photos of toxin powder before mixing it with saline. Have you seen this before? I took this with my own money. After mixing the powder with water, you can see more detailed shapes of the complex with artificial additives. The left side is Botox and the right side is Dysport. The actual particles of the toxins were too small to see, but when they are combined with artificial additives, this is how they look. The two products are not the same because different additives are added. Now, what do you think are the differences between these two products? Let's compare Dysport and Botox. Both vials contain 150 kilodalton of toxin and 900 kilodalton of toxin complex with protein. The first difference is the amount of additives in each product. Each vial has 5 nanograms of complex, but Botox has 3 times more albumin than Dysport. Secondly, their production process is different. Dysport uses freeze drying technique and Botox uses vacuum drying technique. Thirdly, Dysport and Botox use different measuring units. How many units of Dysport are in 1 unit of Botox? The answer is 2.5 units. This means that 1 vial of Dysport can treat twice as many patients as 1 vial of Botox, which means Dysport is more economical and more effective. Here's a study that compared onset and efficacy of Dysport and Botox. Who's the winner? Dysport's onset was 12 hours, whereas Botox's was 48 hours. Also, Dysport's efficacy was 90% and Botox's 65%. Again, Dysport's victory. Let's have a round of applause. Then what about their duration? Here's a paper comparing their duration. The table shows Dysport's duration is longer than Botox's. In the below pictures, Botox lost its effect after 90 days, but Dysport is still effective. This is my own study. I injected Dysport and Xeomin on different sides of one patient. Onset of Xeomin was a little bit faster by 3 days, but Dysport's duration was longer. Its effect lasted more than 6 weeks. My study is still ongoing and its results are not conclusive yet. It is also important to study side effects before we make injection. General symptoms of botulinum are headache, weakness, fatigue, and paralysis. As I mentioned, it is similar to food poisoning. Then, how many vials of Dysport would take to kill a man? It's 70 kilograms. If injected 30 vials, inhaled 300 vials, and eaten 14,000 vials, we can kill a human being. But we only use 5 nanograms of Dysport, so it's safe. However, there can be side effects when it is incorrectly injected by an inexperienced doctor. If Dysport is injected unevenly, eyebrows may go up, what we call a joker face. Treatment is simple. We only need to inject the area with less amount of Dysport. If Dysport spreads to levator, a patient might have difficulty opening his eye. There's a simple preventive method. Don't inject there. Then what do you think is the treatment? It's simple. Just wait. But if you tell your patients to just wait, they'll get angry. In that case, you can prescribe iopidine. Iopidine stimulates Mahler to help open eyelids. It will help with opening eyes until bypass. If Dysport spreads to muscles that control eyes, a patient can become cross-eyed. For this reason, some doctors tell patients not to lie down or work, and tell other doctors not to inject near orbital rim. But I do not think it's necessary. I can say with confidence that cross eyes are an indication of Dysport's injection, not a side effect. Dysport was originally approved by the FDA to treat cross eyes. Which side has a problem? It's the right side. The right side is paralyzed. We treat this with additional injection. Let's look at my case. Let's look at the forehead. We can use Dysport to make baby's face not too angry or old. However, I strongly advise not to inject babies. I'm injecting on glabella. It is more effective to inject close to eyebrows. If you inject too far away from eyebrows, because you're worried about ptosis, it will be less effective in treating frowns. This picture shows my favorite injection points of Dysport. I also inject on ala nazi to reduce large nostrils. When injecting on forehead, it is important to know the location of blood vessels to prevent bruising. Let's think about the temple area. For older people, we can inject on temples to augment the area. For younger people, we can inject to reduce temporalis and can reduce the size of a patient's head. When I inject Restylane to augment the size of forehead, I always inject Dysport with Restylane to prevent Restylane from migrating to other areas. Let's take a look at the eye area. This patient's tear trough area was treated with Restylane. For areas that are difficult to treat with Dysport, I use Restylane. I want you to remember that Dysport is more effective to treat crow's feet than any other toxins or procedures. This is what happens when Harry meets Sally. Amazing, right? Can we inject Dysport on nose too? Usually, I inject Restylane for nose augmentation, and I use Dysport to relax depressor nasi muscle. Depressor nasi muscle pulls down nose tip when a patient smiles and making the nose look humpy. In this case, we need to inject Dysport. It relaxes the depressor nasi muscle. Therefore, Dysport is necessary to make nose significantly higher. This is how high we can make a patient's nose tip. Let's look at the lower face. For loss of facial volume, Restylane is useful. For a bigger face, we can reduce its muscle size with Dysport. This is a photo taken after injecting Dysport into masseter. We should know the simple anatomy before injecting on patients, right? This clip shows injecting into masseter. I penetrate into skin and then inject on 3 points of masseter while keeping the needle under the skin the whole time. This way, my patients feel that I only make 1 shot instead of 3. I injected a masseter since year 2000. In the beginning, many doctors pointed fingers at me and called me odd. But from year 2002, many doctors began becoming really interested in reducing muscle size by injecting on masseter. This is the headline news covering my procedure in 2002. This is a before and after picture of reducing facial muscles. Let's move on to the chin. People with small chins may have cobbled chin. I injected Restylane and Dysport together to augment small chins and even out the irregularity of skin in the area. The cobblestone appearance of the skin was improved. Do you believe that intradermal injection is useful for skin rejuvenation? This is the result of intradermal injection of Restylane Vital. This is a conventional injection method of Restylane and Dysport. This is my new technique. I inject smaller amount each shot, but a much wider area of face. To test the effectiveness of derma toxin, I inject it on my own face with mesogun. On the left side of the screen, face was tightened and looks smaller. Can you see that? I took a photo with microscope and my fine wrinkles improved. I named injecting toxin with mesogun mesotoxin and injecting Restylane Vital with mesogun mesovital. Now then, which area can we use this intradermal injection technique on? I can make skin more hydrated with mesovital. We can also volumize hip with Restylane. We can lift droopy hip with thread very easily. Do you think the hip is lifted up a lot? Let's look at the neck area. I like to inject Vital using mesogun on the neck area for skin hydration. Sometimes I inject Vital subdermally to treat neck folds. We can treat platysma band, turkey neck deformity with Dysport, as you already know. I use small amount of Dysport on trapezius for pain control with placenta. Sometimes when patients want, I inject large amounts of Dysport to reduce muscle size. Now move on to the leg. Mesovital can improve dry skin. We can see in this microscopic picture that dryness and roughness improved. I also treated wrinkles and droopy knees with Vital and gold thread. If these strong legs were a woman's, what can you do? We want to make the legs thinner with Dysport. You can see the calf muscles and nerves. I took this photo in 2003 during neurotomy for a reduction of medial gastrocnemius muscle. 15 years ago, I did neurotomy to permanently reduce the muscle size of legs. Even at that time, I recommended injecting toxin instead of neurotomy to my patients because neurotomy is too invasive, leaves scars, and may cause neuralgia. But at that time, toxin was expensive and patients had to pay $1,000 per session every 6 months. So many patients wanted the operation instead. If the operation is like cutting computer port between computer and monitor with scissors, toxin injection is like temporarily blocking the port. Neuromuscular junction is like a port. Toxin affects the end of motor nerves. This is the shape of botulinum toxin. This clip shows injecting Dysport on calf muscles. In order to clearly identify the location of calf muscles, I tell my patients to push my thigh with their toe. This way, I can find gastrocnemius easily. The medial gastrocnemius was reduced. This is my case in 2002. After the injection, the muscle looks flatter and more reduced. On the right side, muscle volume was reduced. We can reduce vestis lateralis or peroneus longus too. The right side is a very famous sexy singer in Korea. I have been injecting Dysport on her gastrocnemius and peroneus longus for a long time. Dysport makes it possible to treat wrinkles, spasm of face, extremity, neuralgia, and even oily skin or acne. The botulinum toxin is not poison, but an effective treatment for your face and many parts of your body.